Alright guys, welcome to Tim's Takeaways, and this is Tim's Takeaway for the human body. This will be for the EMT level, so if you're listening to this or you're watching this one way, shape, or form, this is a little bit different than previous Tim's Takeaways where they were all basically podcasts, and now we're dealing with a little bit of a vodcast. So when you listen to this, it's probably going to be okay, but there are more graphics that are involved here to hopefully enhance your learning of the human body. And first off, why in the world should we even look at anything with the human body? Well, you're a healthcare professional. That's why. You are learning to become a healthcare professional. And as a result, it means that we need to make sure that we have good working knowledge of the human body. And with that means that we have to be able to communicate with other medical professionals, and we also need to make sure that there are other individuals that we're dealing with that may not understand what it is that other medical professionals are talking about, so we may have to explain it to them. And that's basically what we're looking at. This in no way, shape, or form is designed to take the place of a formal anatomy and physiology course, but this is just giving you a general understanding of what the human body is about. So let's take a look at some of the first areas that we need to help identify. Those areas that we need to first identify are going to be dealing with the planes of the body. Now we deal with the planes of the body, as you can see here, that the human body is going to be able to be split down the middle. So what we'll find here in a couple minutes is that this is being split right down the middle. So if you were to take it from the top of your head, we would bring it down through your nose, your mouth. We would then break it down through your sternum and all the way down to the floor. Then this allows us to break things on each side. So we're talking about that sagittal plane where we're actually looking at, we're talking about different things from the right and from the left. And we're also then dealing with what is going to be referred to as that sagittal plane. We have our corneal plane, which is where we're actually dividing things in half from the front side of the body as well as the back side of the body. And we also need to make sure that we are dealing with that transverse plane, which is actually going to go horizontal. So think of where that belly button is, right about here. And when we see that belly button, we're going straight across, and this is actually making it a transverse plane. So again, that corneal plane is dealing with the frontal area. It's dividing the front and the back. The transverse plane is dividing the body from the top and the bottom. And that sagittal plane is going to divide the body in the right and the left half. Okay? So let's take a look at a few more directional terms. Here we can see that we're going to have to get used to a few things. As you can see that, as we described earlier, the body is going to be divided in half. And when that body is divided in half, we're going to be referring to this as the midline. Okay? So the midline is actually going to divide the body just as the sagittal plane did, where it's dividing the body left and right. So anything that, as you can see in this wonderful little diagram, anything that is moving towards the midline is actually going to be referred to as medial. Anything that is moving away from the midline is actually going to be something that is going to be referred to as lateral. So if we see somebody laying on their left side, it would be left lateral. If they're laying on their right side, it would be right lateral. We also use that indication for identifying locations of the body, of different portions of the body, so if it's more medial or more lateral. Other things that we want to make sure that we are aware of is the difference between right and left. So when we talk about the difference between right and left, we're always going to refer to the patient's right and left. So this means that you're going to have to turn things around for yourself to make sure that you're doing okay. The other thing that I almost forgot about is that as you see these two folks standing here, they are standing in the normal anatomic position. where you can see that their palms are out and they're standing in a full erect position where their palms again are going to be facing you. So that gives us that indication clearly that this is the normal anatomical position. If we're talking about something that, and particularly when you're talking about something that is in the in the arms themselves or in the legs, you can see that anything is going up towards the head is now going to be proximal. So it's going to be proximal if it's heading towards the head. If it is in the main part of the body, one that is going to be identified over here, which is going to be the superior portion. So think about it, if it is on the torso or the core, we are going to make sure that if it's on the torso, that it is going up towards the head, then it's going to be superior. If it is on that torso and it is going down towards the feet, then it's going to be inferior. So we identified those over here as well. And you can tell that there's a difference between the superior and the inferior. In addition to that, the proximal and the distal. So we see here that we talk about the proximal. And again, if you're thinking about this is going more towards the top, or it's going more towards the head, also is going to be something that you can also consider is going to be above. So it's going to be above something as well. And when you get to distal, this is going to be heading towards the feet or heading towards the hands. And this is usually something that is going to be dealing with as lower. Okay, so not always are you looking at those things, but one of the things that somebody can bring up is that the wrist is going to be distal to the elbow, whereas the shoulder is going to be proximal to that elbow. Okay, so just some different ways that you can take a look at it, and pay no attention to my little drawings there. I'm just writing all over this thing. So I think we hit pretty much most of those. Oh, yeah, that's right. Anterior is going to be the front of the body, where posterior is going to be the back of the body. We also need to make sure that as we are seeing here, okay, that the way that the human body is positioned, we're also dealing with the fact that their palms are facing out. So that means that the back of the hand is going to be the dorsal. So you think of back as dorsal, just like a dorsal fin on a shark, or any type of water creature that you may run into. Okay, I think that pretty much covers what we need to take a look at in relationship to looking at the way that the human body is going to be used with directional movement. Okay, so now we're going to move into that whole skeletal area. And just to keep in mind that if you really wanted to take a look and see exactly what I'm using, this is a website that is right up here, humanbiodigital.com. And I'll use some of the examples that are here. So you'll see these for a couple of my podcasts, my vodcasts. And of course, here's me. So this is running off of my account, but we'll take a look at some things here, okay? So you can now take a look at the skeletal system. And we start talking about that skeletal system. Some of the things that we're actually dealing with is the fact that, as you can tell when I bring these options back in, that we're now creating the use of the skeletal system as being one of those things that actually helps give the form and protects a lot of the vital organs that we have inside of our body. Now, for the most part, we're talking about the fact that the skeleton contains about 206 different bones, and ligaments are going to connect the bones together. So if we were to take away the skin here, you can see the ligaments are now going to connect the bones to each other, where tendons, which we're not going to be able to show here all the way, are going to connect muscles to bones. And then finally, cartilage are going to be more of those connective tissues, and they are usually the ones that go on the end of the bones and usually right about the area where some of those joints may be. So we'll take some of this connective tissue away, and now you can see there's just a few things that are truly there. So let's go ahead and we're going to take a look at where we want to deal with our first part of the human body. And that first area we're going to take a look at is going to be the axial skeleton. And that axial skeleton is going to be dealing with we're going to be dealing here with the skull and the spinal column. Okay? So this here is going to be dealing with the axial, A-X-I-A-L. So this is the axial skeleton that we're now dealing with. Now we're going to take a look at these just in a little bit more depth. Let me clear this out. There we go. So we're now going to see that when we get in here just a little bit more, let me move this up here. Okay. That our skull is going to be one of those areas that we definitely want to take a look at. Okay, so let me move this, and now you can see that we're going to now be dealing with some different areas of the skull. Now, one of those areas that we want to take a look at is that you can see that the top part is going to be an area in which there are sutures. Okay, so these here are going to be the sutures, and the sutures here are typically where we have, as children, these things end up becoming fused together later on. So actually, as you're born, these things are actually, this is where you will hear people say that they have the soft spot, and these are the sutures that we're actually talking about. Okay? So other parts that we really need to take a look at is going to be the areas of the skull that include this part right here, which is going to be the frontal area. I'm sorry, as you can see that we're now highlighting where that frontal area is going to be. And that frontal area is going to be the front part of the skull, also going to be referred to as, pretty much for us, our forehead of the different things that we have to take a look at. While this is the maxilla, which is also known as the upper jawbone, this is again the maxilla, and the maxilla is going to be your upper jawbone. These areas that are here that I'm highlighting now are going to be the zygomatic bones. There are two of them. There's one on the right and there's one on the left. And essentially these are also going to be dealing with the cheekbones. These are basically the cheekbones themselves. The bottom jaw is going to be known as the mandible. And as you can see with the mandible, one of the things that we're actually going to be playing with probably later on when we deal with things such as airway is that we are going to be working with this mandible, and we're actually going to be moving it out of place. And the way that we are moving it out of the way is, is that we are going to be causing us to dislocate or actually move this area forward, which is now going to be a nice little joint for us. Okay, so that is one thing that we can definitely take a look at. Now the mandible is also that area in which that is going to be the only one that we can move. Okay, so it is going to be the only one that we can move, and the maxilla, again being that upper jawbone, is not able to be moved. So the other places that we want to take a look at, is going to be this orbital area. And the orbital area, let me get up my pen here, okay, is going to be basically right here. This is where the eyes are going to be. And then we also get to deal with the nasal bone. And the nasal bone is going to be a whole bunch of wonderful little bones that are going to form the bridge of the nose. Okay? Okay, so we're going to take a look at a couple things here. We're going to look at the fact that this, as I said earlier, is the frontal bone. And if we come along here to the lateral portion of the skull, this is going to be the temporal area. Now we'll find out that in this temporal area here, that one of the things, let me highlight this here. So one of the things that occurs in this temporal area is that it's very thin, and that means that sometimes when people hit their head, if they hit it in this area, it can actually sever a artery that actually lies just beneath there. And when you get into head injuries and head trauma, you identify that that could become a problem later on. So we'll take a look also that this is the parietal area, and this should give you a nice little idea of exactly how big that parietal area is now going to be. Okay? This part here is now going to be, if you think of it as being the back of the skull, this is going to be occipital. So this will also, a lot of times ends up just dealing with the way that these function. They're also going to be dealing with that portion of the lobes inside the skull where the brain is at. Okay, so let's see if you can recall what we would call this area right in here. That's right, if you said that that is a parietal area, you're good to go. What about this area that is right below here? Let's see this area right here. All right, awesome. Yeah, there we go. So that is going to be the temporal area. So it gives you some ideas as to different locations of the brain, or I'm sorry, of the skull that you're looking at. So now one of those other things that we need to take a look at with that axial, as we take a look at that axial skeleton, is that we want to take a look at the spine. Okay? So we'll readjust this here. And we're going to take a look at the spine. And now when we take a look at the spine, okay, we're going to recognize that the spine is actually going to be divided into many different areas, or we're going to see that it is divided into a few areas. And as a result of that, let's see if we can get this a better angle for you. Okay, so we'll take a look at the fact that the spine is actually broken down into a whole bunch of vertebrae. And we'll see if we can bring this down. There we go. Okay, so the first thing to try to recall is that when we take a look at this, is that the spine is broken down into very specific areas. And the areas that is going to be broken down to is there will be 7 cervical vertebrae. So if we can count these, there's 1, there's 2, there's 3, there's 4, there's 5, there's 6, there's 7, right? So if we come right in through there, okay, so right about in that area of where your shoulder blades are going to come across is essentially where that cervical spine is going to end. So let's clear that out, okay? So we can remember that there are 7 vertebrae. Then we would need to, so we can say, so then we can say that there are 7 cervical vertebrae. Let's erase that again. 7 cervical vertebrae, and with the ribs, we're going to say that there are 12 thoracic. Okay, so right off the bat, we have 7 cervical vertebrae, we have 12 thoracic vertebrae, and we have 5 vertebrae that are going to be in the lumbar spine, which is where you hear a lot of people complaining of some pain. Now we do have 2 more areas we're going to take a look at. Okay, so one of the other areas that we wanted to take a look at, and I had said about all these little different areas that are truly up in this area, right? So this is where that lumbar area is going to be. And if you recall, we said that there were 5 parts of the lumbar, the vertebrae that are going to be here. Then we start getting into where the back of that pelvis is actually going to be right in through here. Okay, that back of the pelvis is actually going to be the sacrum, and that sacrum is actually consistent of 5 fused vertebrae together. Okay, so they actually help form that whole pelvis. Then down in here, where our tailbone is at, this is where we are now dealing with 4. Okay, so just giving you the idea of, excuse me, when you're taking a look at these things, you want to identify those anatomical landmarks as to how many there are going to be. All right, so somebody had asked me the one day, how in the world can you remember those things? And, I'm not always the best at these either. So one way that I learned to help remember these things is when you eat. Okay, so if you can remember to eat each day, that'll help you out. So one of the things is that you eat at 7 a.m., you eat your breakfast, then you eat at 12 noon, which is now going to be the thoracic vertebrae. Then you eat your dinner at 5 o'clock, and that is going to be your lumbar spine. And then you may end up having your dessert, right about the same time at 5 o'clock. And then about 4 hours later is when you're finishing everything up. And, just one of those things you can try to think about is that if you remember the 7, the 12, and the 5, and then if you can just remember the last 2, which is 5, 4, may help you out a little bit. Okay? Okay, so we did that appendicular skeleton. Now, I'm sorry, we did the, I'm blanking here. Sorry, I know we're moving into the appendicular skeleton. We just finished up the axial skeleton, so now we're dealing with the appendicular skeleton, which is going to be the appendages. Okay, so if you recall that we just took a look at the thoracic area, we took a look at the cervical area, and we took a look at the skull. So those are going to be our main areas. Now we're going to take a look at that appendicular area of the skeleton. And this is where we're going to actually start to take a look at different areas, maybe such as joints. And if you take a look, not those types of joints, but if you take a look right here, you're talking about this is a joint. Even down right here, this is another type of joint. So we do have many joints that are in different locations of the body. So let's take a look at this one here. This is going to be a hinge joint. This is going to be one in which it is good for bending and extending. So one of the other places you can go is not only at the elbow, you can also go at the knee. A ball and socket joint may be something right here, such as in the hip. Here you can see as this femur is coming up, this is now dealing with the femur going into the pelvis. Okay, this is a ball and socket joint. So this is the ball. Let's see if we can turn this around a little bit. There you go. So you can see that this area is now the ball right in here, and here is the socket right here where that socket sits. Okay. So a couple other areas or a couple things we need to take a look at is going to be the fact that the upper extremities are now going to be dealing with, let's start up here at the shoulder area, right? So here is where, let's turn this around here, right? So here again is going to be, what type of joint would this be? So yeah, this joint right here, what would that be? Yeah, this is going to be your shoulder, which is also a ball and socket joint. So here is the clavicle, and this clavicle is actually sitting right on top. This is not, so you hear people say, oh, they broke their shoulder. It's usually they fractured their clavicle bone. So this is your collarbone. The scapula, and we'll turn this around, okay? Their scapula is right here. I always call these the chicken wings in the back of your, on your back. And then, of course, while we're here, we can take a look and say that this area, let's see if I can move him up, okay? This area right in here is going to be part of the, this is now, sorry, I turned Siri on by accident. This is actually going to be the humerus. And this is going to be another, this will be a joint. This is going to be the hinge joint. But this is where that humerus is actually going to be coming down. So that humerus comes down right in there. And you can see that we just highlighted that up just a little bit. There's your scapula. And let's see if we can bring this back up here. Ooh, he's turning all over the place. Okay. And then, of course, there is our clavicle, and we have a left and a right clavicle as well. Okay. So we have those. And then, of course, one of the things that we need to make sure that we do is that we check out the wrist. And we also are checking out the wrist and the hand. So when we take a look at this, okay, you can see that the wrist itself, oops, sorry, didn't want to go in that far. Okay, so the wrist is actually going to be this part that is actually right in this area. Okay, it makes up where the ulna and the radius are actually coming together. So here you can see that that portion of the arm is the radius. This portion over here is going to be the ulna. Okay. And then we're going to be dealing with the metacarpals. And that's all we need to take a look at. So we're looking here at the metacarpals, the carpals, and the metatarpals is usually what people are going to refer to those as. Okay. Remember that the ulna is going to be on the little finger side, and the radius is going to be on the thumb side. And this is also going to be a place in which we start to identify that there is a pulse, and that becomes important for us a little bit later on. The other things that we need to take a look at are going to be right over here in relationship to the pelvis. Okay, so we'll move this over. Okay, so we're going to take a look here at that pelvis, and we'll just open this up. Let's get rid of that. Okay, so we look here at the pelvis. You can see that there is the ilium. The ilium is going to be, you'll hear people say that is the iliac crest. And then we have our pubis, which is going to be right in front. Now remember, as from the anatomy is the way that we're looking at it. Where I'm highlighting is that this is the front of the body. Okay, and then your ischium is actually sitting okay, so our ischium, move them over. Okay, so you can see here, here's where that ischium is. So it's going to be right underneath, or it's actually going to be more towards the backside. And one of the things you want to notice about a when you're dealing with this is that the pelvis itself actually is like a little pretzel. I shouldn't say a little pretzel because it's quite large, but it is actually one of those things that when you break it, it's actually going to break in at least two spots. So just like a pretzel does when you try to break it in half, it's actually going to break in two spots as well. Okay, so that part is the pelvis. Now let's take a look at trying to deal with the rest of the lower extremities. Okay, so the rest of our lower extremities, as we take a look here, are going to be dealing with, here is our femur. And our femur, we have one on each side, is going to be the largest bone in the leg. Actually, it's going to be one of the largest bones in the entire body. And it's really one of the longest. I shouldn't say the biggest, it's the longest. And the hip, again, is going to be that area right in here. And that is actually, so let me bring this back in. This area right in here is going to be something that we get called for quite frequently. It's not that they broke their pelvis, they broke their hip. Other things that we'll take a look at include that we are now going to take a look right in here at the patella. So the patella is your kneecap, and again it is a hinge joint, and it's actually connecting the upper leg to the lower leg. Then we have, as we come down on the big toe side, is the way that I remember it, is going to be your tibia. Your tibia is also your shin bone. And the tibia sits in the front, and the fibula, which doesn't want to highlight for me, there we go. The fibula is going to be the bone in the back. Okay, so that one is actually heading towards, think of it as being more towards that heel, and also is moving a little bit more towards that little foot. Our bones inside of our foot are actually tarsals. There are 5 metatarsals and there are 5 toes, so therefore we end up with a total of 14 phalanges, right? So they call them metatarsals, and we start getting into the metacarpals. The phalanges is really something that we're taking a look at. Okay, so as we said earlier, one of the big things that happens with this is that we are dealing with individuals that when we are truly coming back and taking a look at the skeleton, one of the things that it does do, again, is it helps give us our shape, and it does protect anything that is inside here. So when we take a look at the ribs, and here's where you're actually dealing with that cartilage that's actually connecting them, and then here's your sternum, okay? Those are areas that we're actually starting to take a look at. These are connecting, and they are actually helping to protect the organs that lie within. The skeleton also allows for some movement. It also helps with creating some blood cells. So this actually comes out of the bone marrow. And then, of course, it helps to store calcium, and that's why a lot of people end up drinking their milk. Okay. One part that you usually hear together is going to be the musculoskeletal system. And that's because the muscles actually are usually corresponding with that. So let's take a look at that. Okay, so here we are. We're taking a look at our skeletal system, and we're adding in the muscles now. And we can see that, as in we look at this guy, that there are plenty of muscles that we have to take a look at. And really the musculoskeletal system does help provide some form, makes things more upright, and allows us for some movement. And when we get into the muscles themselves, the easiest things to remember is that there are 3 types of muscles. There are skeletal, smooth, and cardiac. So again, they are going to be the skeletal, the smooth, and the cardiac. And when you think of those, muscles are actually going to be something that are more skeletal. If we look at the skeletal, those are going to be things that are more voluntary control, because we have some type of direct voluntary control from the brain. If we're talking different things such as movement, and this is where things contract and they can also relax. Now, also inside here, you have the smooth muscle, which is going to be found more in the blood vessels in the intestines. So this is where they allow the ability to constrict and dilate, and they are also allowing to help with peristalsis, which is actually going to be some movement, so they can move waste product in the intestines through a little bit easier. And then finally, the only place that we find this is going to be the cardiac muscle cell. That's right, the cardiac muscle cell has its own little place. It has its own part, which is now going to be the cardiac anatomy, and that is something that we'll be taking a look at in and of itself, right? So it'll be its own wonderful little thing. The issue that occurs with the musculoskeletal system is that this is allows us to contract and relax, and it makes it possible for us to move and manipulate in that with that environment. Now, one issue, or one good thing, is that a byproduct of this movement is heat. And I think that you can all attest to this, that if you start moving around all the time, this is something that's going to happen. You're going to start to warm up. So if you're cold in the class, if you get up and start moving around, that does help a little bit. And then when you get cold, you shiver. And the idea of shivering is to help your muscles move and help produce some heat. Now, again, just as we said with the musculoskeletal system, with the skeletal system, when you deal with the muscles and being placed on there, they're also helping to protect the structures that are actually underneath them. Okay, so I think that does it for the skeletal, the musculoskeletal. We spent a good portion of the time talking about this part, and I think we'll take we'll end this part here, and we're going to come back and we're going to take a look at the respiratory system. Okay, so we'll see you on the next one.